I'm here at the Total Health Show and I have the honor of speaking to Shawn Buckley. Shawn, what are some of the important things that's pressing right now in terms of our health freedom?
I think there's three things that we should cover. And the first is, in the last federal omnibus budget bill, there were sweeping changes to our food safety laws, which basically allow the Minister of Health now to exempt any food or group of foods without determining, and when I say exempt them from our food safety regulations and some of the key protections in our Act, without even letting us know. There used to be a publication requirement. There used to be a requirement that before a food or group of foods could be exempted, that the minister had to determine that it was safe to do the exemption. That's just been taken out, and I think people would be shocked to learn that they now no longer can know when they go and buy a food if the food complies with our food safety regulations. We've written a discussion paper on it on the NHPPA site. Just go to www.nhppa.org. I also think that people should be aware that we're still losing products that are key. One of the most recent examples is Health Canada has basically forced people who are selling nattokinase to recall it off of the market. This started in the beginning of November 2012. And for those of your listeners who don't know, nattokinase is used widely as a safe and effective natural blood thinner. A lot of doctors were managing patients with nattokinase, both medical and natural, such as naturopaths. It's available in every other country. We're the only regulatory body I'm aware of that has said, no, you can't have nattokinase in Canada. And the timing was interesting. At the exact same time Health Canada is withdrawing this natural supplement that's safe for, as a blood thinner, it comes into the media that emergency room doctors are complaining about Pradaxa, which is a chemical blood thinner. For example, the New York Times, I think it was November 2nd or 3rd, read a big article about Pradaxa, reporting that emergency doctors are complaining people are showing up at emergency wards bleeding to death, and they don't have an antidote. With the other blood thinners, they have an antidote, they can save you, and basically they have to watch these people bleed to death. And it reported in 2011 in the US, there were 524 deaths from Pradaxa that they're aware of. Well, we're a tenth of their size, so extrapolating, that's 52 deaths in Canada in 2011. Who knows for 2012? That's serious. And yet, so Pradaxa's allowed on the market, and yet nattokinase is taken away. And I think it's important for people to realize that as we're losing these products, there's a health consequence, because people are going to be moved over.
Well, let me ask you this. Why do they pick on that particular product to remove from the shelf, the blood thinner? Why?
Well, I can't tell you why, but I mean, that could be said of all the natural products that have been targeted and moved off the market. If you were to ask me, Mr. Buckley, has it ever made sense to you for any product that you're aware of that's been forced off the market? I would say no. It certainly doesn't seem to have anything to do with safety. The third thing I want your viewers to be aware of is the Charter of Health Freedom has been gaining momentum. Please go to charterofhealthfreedom.org. Or just Google Charter of Health Freedom, you'll find it. The Charter is a piece of legislation that we need to get Parliament to pass, and we have a petition drive on. You can log on there and download a petition document, but please get involved, because we think it's the best chance that we have to bring sanity to this madness.
Is that the best way of making change, is going through that protocol, or are there other things you would suggest that we can do to restore our health freedom rights?
I actually think that's the best option we have, and the reason is we had a big citizen rebellion back in 2004-2005 that basically forced the federal government to back down. And I'm sorry, it was earlier than that. It was the mid-90s. 2003-2004 is when these new regulations came in, which most of us view as a betrayal. We have this big citizen rebellion saying we want more access to natural health products, and the result is a scheme that requires licensing, basically deems natural health products illegal. The same ones that are legal in the US, that's going to restrict our access. So basically what we demanded and what we got are the exact opposite. So the Charter of Freedom is a piece of legislation that we're going to demand letter for letter, period for period, be adopted, not giving them the opportunity to draft legislation. And it's just a wonderful piece of legislation that enshrines our right, our freedom to choose how we're going to treat ourselves when we face a health crisis.
When we look at our chart of health freedom, is there a model outside North America that's a good example?
No,
that's pretty safe?
It really stands alone, and I've seen, other groups have come up with different examples and nothing touches the Charter. And just so you're aware, the Charter does not belong to the group I'm with, the NHPPA. It came about as a collaboration of several groups and practitioners and consumers. There were, meetings held across Canada. How do we solve this? And the solution that we came up with was the Charter of Health Freedom. So it really is a grassroots initiative, and I would encourage all of your viewers to familiarize themselves with the Charter and also to support the Charter and the NHPPA, because all of the groups, ours included, we're starved of support, and we really need it to continue on trying to advocate for your health freedom.
Great. And so that website again is
Okay, so our website is www.nhppa.org, and the Charter of Health Freedom is just www.charterofhealthfreedom.org.
Great. Thank you so much.
Thank you.